All right, so here I'm going to talk about diseases of the reproductive system. And so for the reproductive system, we have some causative agents. You can see on the table, if you look at the actual pathogen, the bacteria, you'll find that most are going to, or almost all of them are going to be our gram-negative bacterium. So we have our Neisseria, chlamydia, treponema, syphilis, Haemophilus ducreyi, which has painful chancroid ulcers. We also have some Gardnerella vaginitis as well. And Gardnerella can look either gram-positive or gram-negative. That's why they have both of those there. But they're the same organism, whether or not they stain with the gram stain. And then, of course, we have our viruses. We have our herpes viruses, cytomegalovirus. We also have human papillomavirus, HIV, and our hepatitis B and C viruses. Of course, hepatitis B and C will enter via the reproductive tract, and then they will disseminate to the liver. For fungus, our major fungal concern is Candida, which can cause a vaginal thrush. And also we have, of course, our parasites, Trichomonas vaginalis. Now we're going to talk about bacteria infections of the reproductive tract, and most of the infections are going to be within the system are sexually transmitted. So oftentimes they're going to be transmitted from person to person, and many of the sexually transmitted diseases are not viable outside of the body, so they die pretty quickly outside. So transmission from person to person is the only way that those diseases keep going. So a lot of times, because of the stigma associated with sexually transmitted diseases, many people will not try to go to their doctors, will not get medical help. And oftentimes people don't even know they are infected because many of these diseases are going to be asymptomatic. So our sexually transmitted diseases can cause arthritis, cervititis, prostatitis, pharyngitis, as well as pelvic inflammatory disease. We're going to see that the most common causes of many of these diseases are going to be a few organisms, and pelvic inflammatory disease is going to be a gonococcal or primarily a chlamydial type of infection. The importance of pelvic inflammatory disease is it can lead to infertility as well as an ectopic pregnancy, a pregnancy not in the appropriate area, which can be very severe for the mother. Now, infections can also infect the fetus and the newborn, so the fetus can cross the placenta, and others, the newborn's going to be exposed to these pathogens as they are born. Now, for our bacteria infections, many of these are going to be localized infections. And again, the symptoms are going to be very minor sometimes and or will not be noticed by the person at all. You can also have deep tissues be affected by these bacterium. You can have systemic infections by them. And so you can see here that we have our Neisseria and our chlamydia. And both of these are going to cause very similar diseases. And then we have, of course, our syphilis, Treponema pallidum, and that's going to be a different type of infection. We're going to have a primary, secondary, latent, tertiary stage, and then congenital syphilis also. Haemophilus ducreyi is going to cause a painful chancroid lesion, and then we're going to have non-gonococcal arthritis, which basically are bacteria that are not Neisseria gonorrhea, and then bacterial vaginitis is going to be caused by Gardnerella. So important with your reproductive infections are the lesions they cause. And so genital herpes is going to be painful grouped vesicles, and these are going to be non-pus forming coalesced ulcers. We have syphilis that are going to be an indurate ulcer that occurs singly, and it has more of a rubbery consistency. Our chancroid from Haemophilus ducreyi is going to be a shallow, painful ulcer which has pus associated with it. And then we also have a lymphogranuloma venereum, and this is going to be a small ulcer or papule, and this is going to typically heal rather quickly. So the genitals have ulcers. They can be pustules that then becomes ulcers, and different infections are going to cause different types of ulcers. Now, sexually transmitted arthritis is going to present as dysuria or urethral discharge or both. And Neisseria gonorrhea as well as chlamydia are going to be most of the causes of this. The diagnosis for gonococcal Neisseria gonorrhea is going to require culturing and or direct microscopy. Detection of chlamydia is going to require DNA amplification analysis. It does not grow well in culture. Epididymitis is going to be the swelling of the epididymis, which is the tube at the back of the testicle. And this is where it stores and carries the sperm. So this is a painful presentation of disease, and you're going to have fever associated with this. And again, the two bacteria are the same bacteria, gonorrhea and chlamydia. Cervititis is also going to present by gonorrhea and chlamydia. This is going to be vaginal discharge, and you're going to have white blood cells found in the discharge as well. So this is inflammation of the cervix. Now for bacteria and vaginitis, this is going to be associated with an overgrowth of Gardnerella. And so you're going to get a yellowish discharge, and we're going to find clue cells. Clue cells are basically your epithelial cells that are going to be covered with bacteria. The discharge can also be associated with vaginitis, but can have other diseases as well, such as cervititis, endometritis as well. And then pelvic inflammatory diseases are going to be caused mostly by Neisseria gonorrhea, or they're called non-gonococcal. And so basically you're going to have a inflammation or abscess form within the pelvis, and these are going to be complicated with respect to your reproductive system, and can also cause sterility in the woman who is presenting with this. Now, if it is non-gonococcal, this can be caused by many different bacteria, and it tends to be more complicated than gonococcal. However, the symptoms tend to be more mild. So swollen lymph nodes is always going to be associated with your diseases, and it's the same thing with your reproductive system. Your draining lymph nodes are going to become swollen in sexually transmitted infections, especially associated with herpes and lymphogranuloma venereum. This is going to typically be a small ulcer, and then you get a swollen lymph node in the groin area to indicate a disease of the reproductive tract.